Thank
There we
you,
go.
Carol. Thank you, Amy. So
All right.
sorry
See you
I
later,
missed
Kate.
this.
Thank
Nice to
you.
meet you, Kate.
All right, bye.
Bye.
Okay, I'm going to go ahead and let people in. Thank you for joining us. We are just giving it another minute to see if anybody else is going to join us, and then we'll start the event for today. All right, I think I'm going to go ahead and start. Thank you for joining us today. Just a few housekeeping things. We are building healthier communities, part of the Building Healthier America Network, and we're speaking with Carol Poppy today. We do ask that if you're in a loud environment, you have your microphone off so we don't have the distraction of noise behind us today. Cameras on or off, either way is fine. Carol is great. She said if you have questions while she's speaking, go ahead and chime in verbally if you would like, or you can enter it in the chat. I'm going to go ahead and introduce Carol. Carol's a nurse educator at the St. Croix County Health and Rehab Center. She has taught for Northwood Technical College, America Red Cross, UW Green Bay, and Century College. She's had 44 years in nursing. She's a graduate of St. Catherine's in Minneapolis. She has extensive experience in multiple facets of the medical field. And today she's going to talk to us about what it means to become a certified nursing assistant. Did I say that correctly, Carol?
You did. You
And
did.
the steps you can take. So welcome, Carol. Thank you.
Thank you. Thank you. Yeah, so I teach here. We have our own program at the St. Croix Health Center as well, located in Richmond, Wisconsin. So besides teaching at the other facilities, and I think that it's a great starting spot for a lot of people, and for some people, working as a CNA is a lifelong career for them as well. And so whether you choose to go on, which is easy to do if you want to go on in healthcare, and it is a requirement for some degrees in healthcare. So for some people that take my class, that's exactly what they're planning to do, is to use that as a starting point. And for others, that's just as far as they want to go for now. And maybe that's as far as they want to go completely. This used to be in the state of Wisconsin, a 120-hour class. It is now, it has to be at least 75 hours. Once COVID came, all of the nursing programs in our state, and actually, I believe federally, went to 75 hours. And so then after the COVID emergency plan, then we went back to, well, you could go back to the 120, or you could go back to kind of whatever you felt you needed, and then you'd request that from the state. For the program that I teach here at the St. Croix Health Center, we're at 80 hours. I believe Northwood is, maybe don't quote me, but I think it's 90 hours. When I teach at Century over in the Twin Cities at White Bear Lake, that is a 75-hour class. And that actually always has been that over there. So, and there's different ways you can teach, or you can take the program. There is, and I think we look at COVID and think there were a lot of things that was a pretty crazy time, and some things that weren't so good. But one thing that came out of COVID was that we decided there were a lot of things we could do online. such as Zoom calls. And so we also decided that we could do an online CNA class. So, and that's what I teach here at the St. Croix Health Center, which makes it really nice for a lot of people that might already be going to college, or I teach, parents that have children and they'd like to take that as more of an evening class, but they can do it at their own time. Our classes are asynchronous, so they don't have to be there at a particular time. They just know that they have assignments Monday through Friday. They're due at midnight, but they can go ahead, read the textbook, and enter the assignments anytime before midnight that assignment is due. So that's one type of a class setting. Northwoods has an in-person class, I believe, and so that one you'd attend. It's going to be evenings during the school year, and then daytime during the summer months, where you go and attend in person. And then Century College has a little combination of both. And there are other classes in our area. CVTC over in River Falls has a class. Some nursing homes have the class of their own. And so there's a lot of opportunities. And of course, in the Eau Claire area and Rice Lake area, there would be more opportunities as well. So that's kind of nice. Now, I will say in summertime, if somebody does want to take this class during the summer, whether you're taking it here or the Twin Cities, you're going to want to sign up ahead of time, because it is, they're usually full, usually January, February. So those classes fill up, excuse me, rather quickly. So otherwise, you might be able to get into a class within 2-3 months and easily find something. So what are the requirements to get into a program? You'd apply and you'd have to fill out a background study. That's going to be taken care of payment-wise by the school. In the state of Minnesota, that would be, they're going to have you fingerprint. And the nice part about that is in Minnesota, once you've fingerprinted, you won't need to fill out another background study. You'll be all done then. So they'll just check once you've maybe changed jobs or gone on to school. That'll always stay current with you. In Wisconsin, we would fill out a background check every time you work for a new place. And then once you are employed in a facility, I believe it's every 4 or 5 years that facility runs another background check on you in healthcare. So we'll do the background check on our students since they're going to be working in the clinical setting with our residents, and then a two-step TB test or one quantiferon would be needed for that class as well. And again, most places are going to offer that TB test free of charge. We do at our facility here. So if you take the class here, we'd offer that free of charge there. We do what we call a two-step TB, and they're usually done about 14 days apart. And we do those so that they are completed prior to the clinical setting. When you go to take care of your residents, or if a person chose to, they could get a blood test called a quantiferon test, and that is just one blood test, and that would be sufficient as well. Those are state requirements. The cost of the class, some people are, maybe thinking about the cost of the class, and does that, maybe have something to do with whether or not you choose to take the class, because that might matter. And that is a little bit of a wide variety, anywhere from, we charge $565 for our class, and that includes a textbook. Some of the prices will go up, like for some other classes, you may go up as high as $1,300 for a class, depending on where you're taking it. And of course, maybe some of the larger schools might charge a little more. You can definitely find free education in a lot of different ways. And I did give some information to the host here today that would be on the WIS caregiver's career. And that would be the state of Wisconsin has $2 million set aside for this budget year to pay for, because we have a shortage of CNAs. So if you weren't aware of that, there is a huge shortage. So, but that is, so the WIS caregiver program would pay you to take the class, and there are facilities that have signed up to be part of that program. Our facility here in Richmond is one of those. And I believe CCH in Hudson may also be part of that. I'd be surprised if they weren't. But long-term care or nursing homes in your area might actually be part of that program already. So you could then sign up through them, and there would be no fee for wherever you choose then to go through that CNA program. They would that cost is covered by the state of Wisconsin in that budget allowance. You would also get some, and I believe you get a $500 bonus after 6 months, and then the employer is reimbursed that amount as well. And I think there's another bonus after that too. So so that's kind of a good incentive there. You have to stay like 6 months with your employer once you've finished. They would also pay for the testing at the end of any CNA program, whether you're, with Wisconsin or Minnesota or any other state. At the end of the program, there are 2 tests that the student would need to pass. And that would get you onto the, in this case, Wisconsin State Registry. So like when you finish our class here, you would be a nursing assistant. In order to be certified, that's the C in CNA, then you would pass what we call the knowledge test and then the skills test. We have and the tester for that, whether you're in Minnesota or in Wisconsin, is a company called Headmasters. They're located in Helena, Montana, and they have testing. The people that come in and do testing as far as like the skills test. In our case, they do it right in our building here. So once our program is finished, which is about 6 weeks in length, then after that, you would take your skills test. We have ours, like if we finish on a Thursday, we have our state test, the skills test on a Friday. And then you can sign up to take the written portion of that skills test, and that's called the knowledge test. And you do that right in your own home on your own computer. And so after you've passed both parts of that, then you're on the CNA registry. So now they do it a little bit different in Minnesota. Not that you couldn't do some of that in a similar setting, but they'll do it, they do a lot of in-person, like as far as the written portion would be done like right at Century College or right at Anoka Hennepin Technical Institute. There's not as much online at home as we have here in Wisconsin. So I do think that's kind of a huge advantage for us to be able to do that in your own home. So that works out kind of nice. The cost is a little different to that test too. We charge the state of Wisconsin when you take that the written portion and the skills portion at the end is $137. If you took that in Minnesota, that's going to be $250. Now again, most employers are going to cover the cost. There is such a shortage of CNAs right now that it would be pretty hard to find somebody that's not going to cover the cost on that, whether you're part of the WIS caregiver program or whether you just go to a facility and ask them, would you cover the cost of my training? So there's a question in the chat. How do you find in-home jobs versus in facility? Well, one way might be Indeed.com. That is an option. The in-home jobs, if you were looking for in-home jobs specifically, then I would contact a licensed home care provider. Now, that, of course, isn't the only place to find in-home jobs. There's a lot of private duty, and a lot of people, a lot of need for that as well. So you could certainly reach out to your local ADRC or Children's Services and see if there's, and maybe Amy, you know more about that than I do. But that would be one option. I used to work for Heartland Home Care, which is now Adderey. They would have more adult caregiving, but there are many other licensed home care providers, and yeah, there's a huge need for inpatient nursing. So yeah, and sometimes it's word of mouth. Your churches, or again, maybe somebody in your area that you might know. That I had a friend of ours actually that posted something at the college looking for somebody to help care for, and that was an adult, just needing an adult caregiver, and they were pretty good about getting nursing students to come and put in a couple hours to help that adult in home caregiving. And as far as facilities go, if there's a facility in your area, or maybe there are some people that actually have relatives in facilities and they're like, okay, I'd like to work in that facility. It'd be hard to believe that they don't need help. So just because there isn't an ad posted out there, you certainly could call that administrator or DON and ask if there's any openings, because I'm pretty sure there's openings in your area, in most facilities. And so yeah, and part of that, and the reason I can say that with pretty much certainty, is that we've done pretty good here with keeping staff, but we still use what we call pool nursing. And so if you're not familiar with what pool nursing is, and that actually would also have personal care worker jobs, you could contact a pool agency and work through a pool agency for personal care worker jobs, which would be possibly in home. Not that you couldn't have personal care worker in a facility, but they do provide cares in home as well. And so those pool agencies will hire people, whether you are a CNA or a personal care worker or RN or LPN. And those agencies, again, if you're not familiar with something like that, that would be something that the caregiver would then just pick up hours kind of where they want. There's no guarantee on those hours unless they sign a contract. And we do have some contract pool agency people working in our facility right now. They'll sign a 3-month contract and then they'll stay for 3 months. And that happened a lot during COVID. Probably more than I guess I've ever seen in my 44 years of nursing career. But and that just speaks to how short people are for staff. But their pay is pretty good. As normally your CNA wages would be, if you get a little further away from the Twin Cities, you're going to be paid a little bit less, so maybe closer to the $15, $16 an hour if you don't have any experience, all the way up to, maybe if you're getting a little closer to the Twin Cities, you might make as much as $23, $24 an hour. There's some agencies that used to have what they called the weekend warrior position, and what that was is that you would, a person would work every Friday, Saturday, and Sunday, and you'd do 3 12-hour shifts. And I think they paid pretty close to $24, $25 an hour, or maybe a little more. And of course, then you'd get full benefits as well. So that worked out really nice for a few college people, or moms that didn't want to have daycare. And so that was a kind of a nice opportunity as well. But that would be sort of the top, in most cases, the top of the pay, $25, $26 an hour. But if you did take a pool job working as a CNA, you could make easily $35, $40 an hour. So again, there's not a guarantee. You wouldn't have unless you signed a contract that you're going to have hours. And the nice part about that is you can turn them down. So, if you had plans for that day, if you're working pool, then if that's not going to work for you, then you can just say no to those hours. So to have that flexibility is nice for some people. So that's another, yeah. The balance of paperwork. What is the balance of paperwork versus direct care, and what does a typical day look like? That depends on where you're working. So if you are working at, like, say, our facility, let's just say you decide to take a day shift in our facility. We're a 50-bed long-term care facility, so nursing home. You'd come in, you'd get report, and you'll be scheduled for like 6 to 7 residents that you're going to take care of. And you'd have a team member that's going to be working alongside of you. So you'll have another CNA that'll have another 6 or 7. But let's just say you have a 2-person transfer, then that person you can certainly lean on, to help you do a 2-person transfer if that's what you need to do. And I'm talking about like with mechanical lifts for the most part. In long-term care or in a hospital setting. And then, you got to get some people up for the day. We do have what's called a bath aide. So in our facility, if you were scheduled as a bath aide, you would just give baths. That would be, you'd go from one person to another. And typically those are showers or whirlpools. And you might do 4, 5, 6 baths on a shift. And so that's all you do from the time you get here. And those baths are usually scheduled. Residents have a particular, a time that they'd like to bathe. Maybe they like to be the first one and get that bath done right at 6:30 in the morning. And then you just go right throughout your shift. If you are scheduled on the floor and you're working as a CNA in the nursing home floor, you'll get your people ready for breakfast, whether that's a partial bath and help them to the bathroom. Some people need very little help, just a little bit of help, and some people need extensive help. And that's where it's nice to have your partner if you need that as well. And some of those people might be passing away. They might be on hospice. We have people that are on hospice in our facility. And so you may be doing some different cares that day for that particular person, or maybe they're having a procedure or they're getting ready to go out on a family event. So your day doesn't necessarily, one thing nice about a lot of facilities is that working as a CNA, it may not look the same every day. There is some variety, and you also have quite a bit of learning that can happen. So maybe somebody's needs a bladder scan. You can definitely go in with your RN or LPN and assist them with that procedure and learn how that's, working and how, and that's the nice part is if you're thinking about moving up the career ladder is learning about all of this stuff and thinking, well, maybe I'd like to do that. And that's where I think it works out really nice for some of, especially the younger high schoolers that come in to work with us. They get an opportunity to see, yeah, I do want to do that. This is exactly what I'd like to do in the future. And for some, they don't, they're like, okay, I like part of this, but I like that physical therapy piece more, and they get a chance to see that, or social work, or OT, or speech. So, and of course, we have all of that. And when you say what is the balance of paperwork, well, there isn't a lot of paperwork in long-term care or in a hospital setting. You would see quite a bit of paperwork if you were as a CNA, if you were in a home care setting. At least most of the home care settings, I did home care for off and on for quite a while. And we did a lot of paperwork just because at the time we didn't have a computer set up there. It was just pretty minimal. So we charted a lot. You will chart here, but most of that's on the computer. The same with the hospital setting. We need to make sure we document what we do for the CNAs, as well as any other healthcare worker here. We do some of that because of billing purposes, and so that people can look back and see too, how is she progressing? How is that resident progressing? And were there any setbacks or changes? We look back and see were there any changes in her status here along the way, or so that we can report to the families. So for a lot of reasons, we do actually a fair amount, but it's pretty streamlined. So and there's time in the day for that, definitely. As a person gets hired here, they would take 1 to 2 weeks to orientate, usually at least 2. To make sure, first of all, you got to get used to your setting, and that's pretty standard no matter where you go to work, to make sure that you feel good about where you're working and understanding what's expected of you.
Carol, as you're chatting, and I'm thinking about the people that are part of the Building Healthier Communities group. As we discussed, it's a lot of families with children, or could be adults with disabilities or special needs. And I know in some of our conversations, we talked about how that could come full circle. So, if you've already had this experience because you have a child with a disability, you've already done a lot of these things. So am I understanding correctly that these classes would be helpful, A, to make sure you're doing things safely, and then also as your own child gets older and maybe moves on with caregivers, since you already have that experience going into this as a profession, to help you out with a second income, or if you've stayed home with your child, it's an easy way to get some income with some experiences that you already have, correct? And possibly we talked about being reimbursed by waiver programs as their adults
Definitely.
or child services.
Right. Yeah, definitely. I think that, I just looking back at, I did home care off and on in between facilities. We had 4 children, my husband and I, and just for financial reasons, but also it worked really nice because we could kind of do odd hours, and it worked so I didn't have to have a sitter. And I think thinking about some of those families, and maybe some of the people that you're helping here, I just think knowledge is very important, because you may have learned in healthcare, there's 50 ways to do any one thing. So I could transfer somebody one way, or I could set up a room one way, but we could set it up 50 different ways. And it could be very advantageous to look at how things are done. So how we're taking them out of bed, and how we're putting them in a wheelchair, how we're bathing them, and so I just think that the knowledge, a lot of times somebody might take my class because they're like, well, I'm going to care for my parents. their elderly parents. And I have told them I would take care of them in their home. And I just want to make sure that I know the proper way to do things so that it's good for myself. I'm not hurting myself, but I'm also like, understanding like the right and wrong of things, or just looking at it in a different way. And I do think, home care is, sometimes in home care, we do things because we're the only person there. So we're going to do it a particular way because that's maybe not how the book says it at all. But guess what? I'm getting, so-and-so from the recliner to the wheelchair. That's the way it's going to be because it's just me. And so we want to do things as good as we can, not to harm ourselves or the person that we're caring for. And so I think, yeah, and I think sometimes too, your how you look at things, if a person, that's a hard time is when you are the main caregiver and you're doing this 24/7. But I think if some of your families, if they could get outside of the home and use some of those skills in another setting, not only is it advantageous just to learn other things, but that feeling that I think it's a great feeling to share it. This is a highly rewarding job, and not that they don't have a huge reward for caring for their own person. But it's a decent paying job, and again, there's a lot of opportunities out there, and sometimes to have that really good feeling that doing all this stuff at home, and that's wonderful. But I also really feel great about myself because maybe that is a career path that they do want to keep going on. And there's so many great opportunities. Now is the time to get in on going into healthcare if you really would like to, because like I said, I don't know of anybody that really needs to pay for. There's so many places that are more than happy to pay for your education for this. So whether it's through the WIS Caregivers Program, or you just go to the local nursing home and ask them if they'd pay for your training, I'd find it hard to believe that a lot of places are not going to do that because there's quite a need. So we have in our facility, we have what's called a class agreement. And so people would sign that, and then we would pay for their class and their testing, their state testing, and then they would just take a part-time job here, which in our case, even if it's 16 hours every other week. So, every other weekend, they work, like a Friday and a Saturday, or a Saturday and a Sunday shift. And then they get a $500 bonus at 6 months, and then another $250 at another 3 months. So it really turns out to be quite a good deal. And like I said, you never know, it could be a career path that they'd like to go down.
Is there
Yeah.
a minimum age requirement to become a
There is.
CNA?
It isn't necessarily, I mean, some schools or some nursing programs will have a minimum age. We don't necessarily have one here. But I usually tell families that you could take the class when you're 15, but you can't take a state test until you're 16 years old. So if you were almost 16 and you wanted to take it, that really turns out pretty well. And then by the time you finish, maybe you turn 16, then you can take that state test, because you can't be on the registry in our state or the state of Minnesota until you're 16 years old.
Okay,
So,
helpful to know. Helpful to
yeah.
know. I think as we kind of wrap up here, we have your contact information in the chat for anybody that has questions. And as we mentioned, this event is recorded, so it will remain for people to reference moving forward and to share with others. So your contact info will be in there. And you said you're more than welcome to answer questions from anybody or help
Definitely.
them
Yep.
navigate that answer.
Sure. Yeah, definitely. And there's been some people that have been a CNA in the past and then they decided, I let that lapse. What should I do? They can certainly contact me, or you can contact the state that you're living in. They're really good about helping you to get back on the registry. So Minnesota has what's called a challenge test. So you actually don't even need to take the class. You can challenge the state. So I don't know the percentage of the pass, but that happens. If they're for their state testing, you literally could just take it's called a Minnesota State Nurse Aid Challenge Test, and you go ahead and sign up for the state testing, and you can take that test, and it'll be a skills test and a written test, and if you pass, you're automatically a CNA. So. For some people, they already know quite a wealth of information and, so
Interesting,
lots of
interesting.
opportunities. Yeah.
For sure. Just going to throw this out there. If anybody else has any questions, please put it in the chat. Otherwise, we're going to go ahead and wrap up for today. I think we're good. Thank you so much, Carol, for joining us. Thank
No
you to
problem.
our audience. Please make sure you head over and sign up for our upcoming events. So once you sign up, you'll get emails notifying you of all new events. Yeah, and you'll be able to be a part of our community. Thank you so much, Carol.
Wonderful. Yep. Bye-bye.
Bye-bye.